WJR's Marie Osborne sat down with Dr. Michael Donahue and Dr. Saul Cogan. Listen here.
I usually see people after they've done all that and they're desperately trying to avoid surgery. And I'll tell you, my heart goes out to each and every one of them because I get it. I was there. I understand. And I just know that we want to do everything we can to help people in the most conservative way possible.
And again, so would you, Dr. Donahue, would you suggest intradisc neutrosis at the Disc Institute?
Absolutely. I think it's excellent science. I've read the papers, the literatures. I've actually gone over to the center a few times and had it done to me. I, like Saul was saying before, have had back injuries, and I really can feel for my patients because I understand what it takes and what it means to be disabled by it.
And disabled it is. And really, you're talking about people who've had their quality of life robbed from them. I'm sure both of you have had extensive encounters with that among your patients. So, Dr. Donahue, I'm curious, have you personally had patients that needed surgery where you felt maybe the surgery was warranted, but the patient didn't end up having it because they had a positive procedure at the Disc Institute?
You know, Marie, that brings up, it's a really timely question, truthfully. With COVID, I've had a lot of patients had significant symptoms, had tried and failed non-surgical means, and they just did not want to go into the hospital and spend 2 or 3 days in an environment where they could be set up for disease. So we've tried and had them do intradiscal neutrosis, and they've had some great outcomes. And it's really opened my eyes up even further than they already were to trying different things other than surgery.
And Dr. Cogan, that's got to make you feel pretty good when you have a patient come in and you're able to help solve their problem without any further evasive action for them.
Absolutely. I mean, our goal is to help people get their lives back. And I will tell you, I was thinking about this the other day. I couldn't ask for a better job. I mean, I love what I do because every single day we see people get their lives back. And I can't even begin to describe how that makes you feel.
Well, certainly seeing people in pain in your office has got to be overwhelming. And then when you're able to solve their problem, that definitely has to be a real plus and a good day, as they say at the office. We're talking to both Dr. Saul Cogan of the Nerve and Disc Institute and also Dr. Mike Donahue, a local spine surgeon with locations in the metro area. He's the president of the Center for Orthopedic and Sports Medicine in Rochester, also an assistant professor at Michigan State University.
Thank you very much, Marie. And Dr. Cogan, you know what's interesting is having that relationship with somebody like Dr. Donahue is really very important to not only you, but also your patients when trying to determine what's best for them.
Absolutely. There's no question. I mean, what I like best about Dr. Donahue is how conservative he is. You know, if he sees, 50 people in a day, he may order a couple surgeries. He's telling people to do everything they can, and I really respect that. And he's a really nice guy.
Yeah, that doesn't hurt either. I want to just throw this out once more because you're throwing out an offer for 20 callers, which is just buku, and I think people need to take advantage of it. I want you to remind them what that is.
Yeah, so for the first 20 callers, we're offering a comprehensive 2-day evaluation. Day 1, the patient comes in, meets with my assistant. We gather all the information and scans and so forth. Day 2, if it looks like they may be a candidate, they'll meet with me. I'll do a comprehensive consultation, examination, and go over any findings. And it's to determine if we can help them. If we can, we'll tell them. If not, we'll tell them that too. But we're offering it for no charge because we really want to have people have the ability to see if they are a candidate to have this life-changing treatment.
Incredible stuff. And that number to the Nerve and Disc Institute, 586-416-DISC. That's 586-416-3472. Doc, always great catching up with you. Thank you for the time, and thank you for doing what you're doing for people. It's wonderful.
Oh, my pleasure. Thanks for your time, Chris. I appreciate you.
Yep, you got it. Chris Renwick here, 760 WJR. Thank you so much for for joining us today. Again, if you want to learn more from the Nerve and Disc Institute, you call them today, 586-416-3472. Have yourself a wonderful one.